Young patients with MPN are a special group that are really close to my heart, and we've been working hard to try to collate knowledge in this area. Actually, since I became a consultant 2 decades ago, looking, for example, at pregnancy outcomes, that's been really important for us to be able to give patients ideas about outcomes and think about how to manage and standardise that. But also across the European Haematology Association, MPN-SWG, we've been working with lovely colleagues like Marta Sobas in Poland, Jean-Christophe Iannotto and Jean-Jacques Hilagen in France to collect data from young patients, so under the age of 25 at the time of diagnosis, understand the spectrum of disease, why we treat them, how we treat them. And so we've learned a lot from that in terms of outcomes. We've learned about that our treatment approach is a little bit different. We don't have guidelines for that. We don't have much evidence base. So trying to pull that together. We've recently seen, for example, that in young patients, interferon and only interferon therapy prolongs myelofibrosis-free survival, which is 20% risk at 20 years. So if you're diagnosed when you're 23, you're still going to only be in your mid-40s by that point. So really important to see that. What we are now also trying to do is empower these patients by gathering them together in a specific international young persons group to help us to, one, that they support each other, that they tell us what their needs are and we work with them, but also to try to draw some EHA guidelines together for the management of those patients. So it's still very much a work in progress, but I'm just increasingly aware for these young people that their needs are really unmet by our current algorithms.